This is me Arzu here and I welcome you to my channel Mr. Teeth, where your dental concept get dissected. So this is our part first video of the oral mucous membrane, and in this video we will be just discussing with the introduction to the oral mucosa. Okay, oral mucous membrane or oral mucosa. Okay, and this chapter, oral mucous membrane, is one of the biggest chapter of this dental histology, and it is also the most important chapter in dental histology. So you should have to learn this chapter very well, and I have prepared the proper note of this chapter, okay, that I will be discussing in the videos. And as this is a part first video, we will just discuss with the introduction, classification, skin versus oral mucosa. Okay, so there are some difference between the oral mucosa and the skin. We will discuss with that, and the clinical features of the oral mucous membrane. Okay, and I assure that you shouldn't have to be worried in this chapter, as this is a very important chapter, okay, of this dental histology, as like that of the development of the tooth. Okay, so development of the tooth is also one of the important chapter. Similar like that, this oral mucous membrane is also one of the most important chapter. Every time in the theory exam, okay, there is one question that is from this chapter. Okay, so you should have to concentrate properly, follow my instruction, follow all those notes, okay, and proper listen my concept. Okay, so the concept that I will give in this chapter will be very fruitful to you. So without delaying much, we will start this chapter. Okay, so in that introduction portion, in the first point, as I have written, body cavities that communicate with the external surface are lined by the mucous membrane, and they are coated by the serous and the mucus secretion. Okay, so body cavities, they communicate with the external surface and they are lined by the mucous membrane, and they are mostly covered by the serous or the mucus secretions. Okay, so this is the first line of the Orbans. And after that, in oral cavity, in another point, in oral cavity surface, okay, is the mucous membrane. Okay, so just you guys have to take the concept that, okay, so oral mucous membrane means it is a mucous membrane of the oral cavity, means the oral cavity surface is the oral mucous membrane. Okay, after that, in another point, there is written the boundary of this oral mucous membrane, and in the boundary section, okay, so in anterior portion it is continuous with the skin of the lip through the vermilion border, and posterior it is continuous with the mucosa of the pharynx. Okay, so this is a boundary. Okay, so in anterior portion it is connected, it is linked with the skin of the lip, and that is through the vermilion border. Okay, and I think you know this about vermilion border. I think you have studied about this in GIT, you have, but I will show you the picture in later in this video itself. And in the posterior section it is connected with the GIT. Okay, so in GIT pharynx. Okay, so it is continuous with the mucosa of the pharynx in posterior portion of the oral mucous membrane. Okay, and in the oral mucosa, the mucosa which is situated between the skin and the intestinal mucosa. Okay, the same concept, that is, okay, so skin means the lip, okay, the skin of the lip, and also the intestinal mucosa means mucosa of the pharynx. It is a starting of the GI. Okay, starting of the GI is the oral cavity itself. Okay, but intestinal mucosa means here that is a pharynx. Okay, after that, in the next point, structure varies in the adaptation to the function in different regions of the oral cavity. So structure of this oral mucosa, it varies with the adaptation to the function. Okay, like there is a masticatory mucosa, there is a lining mucosa. So masticatory mucosa are adapted in such a pattern, okay, so they are keratinized, so they can resist a larger forces. But the lining mucosa, they are not keratinized, they are non-keratinized, and they resist the lower forces. Okay, so with the adaptation to the function, okay, so there are different structure present in the oral cavity, in the oral mucous membrane. Okay, so in the introduction portion, you just have to know that oral mucous membrane or the oral mucosa is that portion, it is that surface portion of the oral cavity, okay, that is present between the skin and the intestinal mucosa. As the oral cavity is present between the skin and the intestinal mucosa, so the surface that is lining the, okay, so mucosa means the lining of any surface of anything. Okay, so the oral mucosa means it is the lining of the oral cavity. It is simple to understand that, and you shouldn't have to be more bothered in this point. Okay, and the boundary you should learn. Okay, so anteriorly it is connected with the lip, everyone knows it, and in the posterior section it is connected with the mucosa of the pharynx. And this is very important point here with the adaptation, okay, to the function. The structure varies, okay, with the different regions in the oral cavity, okay. So a different region, okay, there is different features of the oral mucous membrane, and we will discuss with that in later in this video itself, okay. And in the next topic, subtopic, I have written some difference between the skin and the oral mucosa, and this is very important, okay. So this is a very favorite question of the viva, okay. So in viva, the examiner can ask you that tell me some difference between the skin and the oral mucosa. What are the proper, particular, specific difference between the skin and the oral mucosa? Then you can tell all those points, okay. And also this question is famous for the theory exam, so prepare this topic well. So in the first point, epidermis and dermis are present in the skin, and in the oral mucosa there is epithelium and the submucosa present, okay. So about this epidermis, dermis, okay, so I think you have learned in the skin, okay, in general anatomy we have a proper 4 different layers of the skin, okay. So we will be discussing with all those layers of the skin properly in upcoming videos, but for now just you should remember that epidermis and the dermis is present in skin, but in oral mucosa there is epithelium and the submucosa, okay. After that in another point, stratum lucidium is present in the skin, but it is absent here, okay. So this is also coming under the epithelial portion, okay. So in epithelium we have different layers, so, and stratum lucidium is one of the layer that is present in the epithelium, okay. So this stratum lucidium is present in the skin and it is absent in the oral mucosa. After that, in another point, appendages, okay. So in appendages section, the hair, sebaceous gland and the sweat gland are present in the skin, okay. So there is a hair follicles are present in the skin, sebaceous glands are there, okay, and sweat glands are there, okay, in the skin. But in the oral mucosa there are not such appendages, but there is a sebaceous gland and the salivary gland, okay. So there is a there are those salivary gland is the most important appendages of the oral mucosa, and also there is a sebaceous gland present there, okay, but this is not functional in the oral cavity. After that, in the next point, connective tissue derived from the mesenchymal cell in the skin, but connective tissue derived from the neural crest cell and the mesenchymal cell. So they are called ectomesenchyme, but they are mesenchymal origin, okay, and they are ectomesenchymal origin. So you should have to remember that skin is derived from the mesenchymal cell. Connective tissue of the skin is derived from the mesenchymal cell, but the connective tissue of the oral mucosa is derived from the neural crest cell and the mesenchymal cell. And the color of the skin, okay, so it can be fair to black, okay. So I haven't written here fair, okay, fair to black in color. And after that, in the color of the oral mucosa, it is mostly the coral pink, okay, and also it can be little bit darker. So there are variety of color present in oral mucosa and the skin, okay. So you should just learn from this difference is that, okay. So in skin we have epidermis and dermis, here epithelium and submucosa. Stratum lucidium is present here but absent here. In appendages we have hair here, sebaceous gland, sweat gland, but here we have sebaceous gland which is non-functional and the salivary gland which is functional and the most important appendages of the oral cavity. And the connective tissue of the skin is derived from the mesenchymal cell, but connective tissue is derived from the neural crest cell and the mesenchymal cell. So they are called ectomesenchymal origin. And the color ranges from fair to black, okay, and here the color is mostly coral pink, but also a darkish pinkish color can be observed in the oral mucosa, okay. So there is variety in the color in both skin and the oral mucosa, okay. So now we will discuss with the classification of the oral mucosa. And in the classification of the oral mucosa, so we have classified the oral mucosa based on 2 functions, okay. So one function is based on the depending on the 2 bases, and one basis is on the functions and another basis on the degree of the keratinization, okay. So first we will classify the oral mucosa depending upon their function. So as I have discussed previously in the introduction part of the oral mucosa, there I have told that the structure varies, okay, in the oral mucosa, and they are different due to the adaptation to the function, okay. So there is a different masticatory mucosa, lining mucosa, and specialized mucosa present in the oral cavity depending upon the function. So the masticatory mucosa are more useful. They are helping, they are supporting in the function of the mastication. Okay, so the gingiva and the hard palate, so they are the masticatory mucosa, and this masticatory mucosa, they are immobile, tightly bound to the alveolar bone, and their keratinized epithelium is present there, dense lamina propria and thin submucosa. Okay, so this is a overview of this masticatory mucosa. Okay, so these are the points that are under this masticatory mucosa. So you guys just have to remember that masticatory mucosa is that mucosa of the oral mucous membrane that help help the tooth, okay, for the mastication. So gingiva and the hard palate are present in this masticatory mucosa, and they are immobile and they are tightly bound to the bone. Bone means alveolar bone, and the epithelium that is keratinized here, and dense lamina propria is present there, and thin submucosa is also present there. After that, in the lining mucosa, everything is opposite of that masticatory mucosa, means they are mobile, okay, and they are also called reflecting mucosa here, and they are tightly bound to the bone as in the masticatory mucosa, but they are not tightly bound to the bone, they are loosely bound to the bone, and they are non-keratinized and not dense lamina propria, but they are dense lamina propria is here, and thin submucosa, but the prominent submucosa is present in the lining mucosa. And the oral mucous membrane portions, okay, that comes under this lining mucosa are the lips, cheeks, vestibular fornix, alveolar mucosa, soft palate, and the floor of the mouth. Okay, so lip, I think you know this, cheek also I think you know this, okay, and vestibular fornix. Okay, so vestibule means it is a space, okay, so it is a horseshoe shaped space that is between the gingiva and the oral cavity. Okay, so oral cavity is between the cheek, okay, so that will be more better, between the cheek and the gingiva, so there is a hollow space, horseshoe hollow space is present there, that is called vestibular fornix. And alveolar mucosa means the mucosa over the alveolar bone, and the soft palate and the floor of the mouth. And the another is the specialized mucosa, and in this specialized mucosa means it is the dorsum of the tongue. Okay, so specialized mucosa means they have some specialized functions, okay, like that of taste sensation, so that is having the special function, that is taste sensation. Okay, so dorsum of the tongue comes under the specialized mucosa. Okay, so you should prepare properly this classification. Okay, so this is very very important classification of this dental histology. Okay, so I will again repeat once that depending upon the function, there are particularly three different kinds of oral mucosa. First is masticatory mucosa, another is lining mucosa, and third is a specialized mucosa. And the masticatory mucosa, they are immobile and tightly bound to the bone, and they are keratinized, loose, dense lamina propria is there. Okay, so they have dense, they are keratinized. Okay, so they are quite of strong mucosa. So keratinized, dense lamina propria, but submucosa is thin. And in the lining mucosa, they are called reflecting mucosa also, and they are mobile, loosely bound to the bone, non-keratinized epithelium is present there, and not a dense lamina propria is there. And the thin submucosa that is present in the masticatory mucosa, but we have prominent submucosa in the lining mucosa. Okay, and the points and the portions of the oral mucosa that comes under this masticatory mucosa and the lining mucosa is that, okay, so the lips, cheeks, vestibular fornix, alveolar bone, alveolar mucosa, soft palate, floor of the mouth comes under this lining mucosa. Okay, and you should learn all those, remember all those portions of the oral mucosa. And specialized mucosa, they are for special function, and dorsum of the tongue is a specialized mucosa. After that, in the another classification, okay, so it is depending upon the degree of keratinization. So one is keratinized, another is non-keratinized. Keratinized means having keratinized epithelium. So keratinized epithelium we can see on the masticatory mucosa and the specialized mucosa. So gingiva, hard palate, and the dorsum of the tongues comes under this keratinized, but all lining mucosa, they are non-keratinized, so they comes under this non-keratinized portion. Okay, so remembering this function, okay, you can remember this also. So this is very easy to remember and you should remember this properly. Okay, after that our next subtopic is the clinical features of the oral mucosa. Okay, so color, as I have written here, it is coral pink. Okay, sebaceous gland present in upper lip and the buccal side. Okay, and mucosa, there is presence of this fordyces spot. Okay, so they are fordyces spot, we will be properly discussing with this in oral pathology, and they are quite of similar with that of the sebaceous gland. Okay, just you remember here that. Okay, so in mucosa there is a fordyces spot, and the sebaceous gland that is present in oral cavity is non-functional. After that, tongue shows the papillae on the dorsum surface. Okay, so in papillae we have taste buds. Okay, and we will be discussing the taste buds also in upcoming videos, but for now you should remember that in the tongue, in the dorsum of the tongue, there is a papillae. Okay, papillae on the dorsum surface of the tongue. After that, transverse ridges on the hard palate. Okay, so there are transverse ridges that are present in the hard palate. I think you know it. After that, in next point, mucosa on the lips and the cheek, they are soft and pliable. Mucosa on the gingiva and hard palate form and the immobile layer. Okay, so the same thing is taken from here. Okay, so now I will show you one picture, then I will explain more about this. So in this picture, as you can see here, okay, so in this picture, as you can see here, okay, so this is a masticatory mucosa. Okay, so this is a gingiva, the brownish portion is the gingiva, and this hard palate. Okay, so hard palate is quite of anterior and soft palate is a posteriorly present. Okay, and this dorsal tongue surface means dorsal tongue surface, we can see the papillae here. Okay, so spot like structure are present there, so they are the papillae and they constitute the taste bud and they are responsible for the taste sensation. Okay, after that, here also we can see the lining mucosa. Okay, so in the lining mucosa you can see the lips, soft palate, cheeks. Okay, so they are under the lining mucosa. Okay, and the vestibule that I have told. Okay, so this horseshoe shaped structure, okay, that is present between the gingiva and the cheek. Okay, so that is a cheek, the more better will be lip. Okay, so between the lips and the gingiva. Okay, so that is the vestibular fornix. And circumvallate papillae, we can see here folate papillae. Okay, they are present laterally, and fungiform papillae are present here on the dorsal surface of the tongue, and filiform papillae. Okay, and filiform are present throughout the tongue. Okay, so about all those papillae we will be discussing properly in upcoming videos, but from this picture you should know the overview. Okay, the main motto to show this picture is that you can take the overview of this oral mucosa. So masticatory mucosa is here, lining mucosa, and there specialized mucosa is present there. Okay, after that, here in this oral cavity, so there are structure. Okay, so this is upper lip. Okay, so this is a superior labial frenum, and this is a hard palate. Okay, so this is a hard palate, and we can see the transverse ridges, transverse palatine fold are present there. Okay, so they are transverse ridges. Okay, so there is a transverse ridges, I think you know this, and we have soft palate there, glossopalatine arch is there. Okay, palatopharyngeal arch. Okay, so anteriorly there is glossopalatine arch, and in the posterior portion we have pharyngeopalatine arch. Okay, after that, and between it is called palatine arch. After that, this is uvula and fauces. Okay, so fauces means quite of opening. Okay, and this is the opening of the pharynx, and in this side we can see the teeth. Okay, so the molar, premolar, canine, lateral incisor, central incisor, and here is the lingual frenum. So lingual frenum is the mucous membrane like a structure. Okay, that connects the tongue with the floor of the mouth, and there you can see the gingiva, inferior labial frenum, and this is a lower lip. Okay, and the vermilion border is present here. Okay, so vermilion border separates the lip. Okay, the skin of the oral cavity with that of the mucous membrane of the oral cavity. Okay, so I think I have been successful in explaining all those points. Now I will be discussing in more detail in upcoming videos, so you shouldn't have to be worried in this oral mucosa chapter. Okay, you should trust me and follow all those videos and the notes. Okay, and I will make you master in this chapter. So after saying this much, I'll meet you in the next video of this oral mucosa. Till then, stay happy, stay healthy, and for the notes of those video you can visit my Telegram channel, and the link of the Telegram channel is just below this video. Okay, so I posted the link of the Telegram channel in the description of this video. You can visit that channel. Okay, so thank you.